pharmacy student, and I'm doing my API rotation with Dr. Craig Stern. Today I will be talking about health plans. So just a brief outline of what health plans are. An outline of what I'll be talking about. I'll talk about what health plans are, what are the different types of health plans, and the different quality measures that they measure, so that to help compare different plans within and with other plans. What are some risks that insurance companies face? How are they financed, and also what the future of healthcare and health plans looks like. So what is healthcare and what are health plans? Healthcare is an organization of services that help improve and maintain mental and physical health for people, and health plan is what helps consumers pay for those different services, for those healthcare costs. And you have two main types. They could be the taxpayer funded, which include Medicare and Medicaid, and these are funded by federal and state taxes. Or you also have private funded, and those are primarily funded through the benefit plans that different employers provide. For example, Blue Shield and Blue Cross. So I'm going to go over different examples of health plans. One example includes the exclusive provider organization. And with this type of health plan, consumers, they are covered the kind of costs that are within their network. So doctors that are within their network, and it's through a fee-for-service basis. Another type are the health maintenance organizations, also known as HMOs. And again, coverage is based on doctors and different healthcare professionals that are within their network. And they focus on prevention and wellness. For example, we have Kaiser Permanente. Another type are point of service, and these, when consumers use healthcare professionals within their network, then it costs less for the consumers. And if you would need to see a specialist, it would require a referral. These are other types of health plan types, for example, preferred provider organization. And with this one, you can, again, if it's within the network, it costs less. However, you could go out of network, but it would cost more for the patient, but it does not require a referral. And then you have the tax-funded ones, which include Medicaid and Medicare. Medicaid is for low income as well as disabled people, and Medicare includes Part B coverage, begins at 65 for medical services that are deemed necessary. And you have your self-funded ones, which are employers that they contract with insurance companies to cover employers and dependents. So with these different health plans, the importance of these is that they can differ based on out of coverage costs. So some of them, like HMOs, while they might not cover out of network costs, PPOs will cover out of network costs, but it will be more expensive for the patient. Or primary care physicians. So if with some of these networks, the consumer does not need to have a primary care provider, but for some of them, they would need to have a PCP. Now, these are essential health benefits, and these are defined by the Affordable Care Act. And these are separated into different categories, just to make it easier to be aware of them. So, for example, hospital and emergency room care, so emergency services, which include also transportation, and hospital care, which can include inpatient services, for example, surgeries. You have non-hospital care, so ambulatory care like doctor visits, also pregnancy, maternity, and newborn care, so while you're pregnant, after the pregnancy, and also for pediatric services, which include oral and vision services as well. You also have preventative services, which can include counseling, screenings, immunizations, medication and tests, which include coverage for prescription drugs and laboratory tests, and then supportive services, which can include mental health and substance abuse, so different counseling and behavioral health, as well as different chronic conditions, disability, and injury, so different services for those. And like others, for example, radiology services, those will be covered based on as needed for the different areas. So these insurance plans, they offer different services, but it's important to also see the quality of them. So are they safe? Are they efficacious? And how do you compare them? So there are different quality services and measures, and these not only help the different plans have internal control to see how they are doing, but also for people who are interested in insurances to be able to compare the different insurance plans. So for example, you have the National Committee for Quality Insurance, and one of their measures are the HEDIS measures, which is the Healthcare Effectiveness Data and Information Set. And these look at the different measures that are covered and to see how patients are doing with the different services. For example, asthma medication use, breast cancer, as well as immunization status of the different patients. Another organization, the Utilization Review Accreditation Commission and the Health Plan Accreditation. This helps to make sure that the different health plans, they are accredited and they are providing quality care and services. And they can include care coordination, medication safety, and compliance. A third one, the Pharmacy Quality Alliance, and one thing that they measure is proportion of days covered. So within a set period of time, how many days is that medication covered for? And this can include medications, the 3 renin-angiotensin system antagonists, the diabetes, and statins. So with the different plans and the different plans and different services that they provide, these insurance companies are under risk for different factors. One of them includes adverse selection, another moral hazard. These two I will be talking in more detail in the next few slides. Other include specialty or high-cost medications, especially now with the growth of so many specialty medications, it can cause higher costs for different insurance companies. Fraud and abuse, for example, patients using other people's insurance family members to be able to get medication, and that's causing extra costs for the insurance companies. Misdiagnosis, if a patient is misdiagnosed and the insurance company has to cover the cost for that patient, that's an increase of cost. And also market competition, since you have so many insurance plans out there to choose from. So you have to be working and being able to provide something that consumers would be interested in. So the two main that we talk about, one of them, adverse selection. So what is adverse selection? Adverse selection means that consumers that are most likely in need of healthcare services, they're the ones that are most likely going to want to buy into an insurance. And what this means is that when you have a lot of consumers in a health plan who are using a lot of the services, you're going to have higher premiums, which is however the amount that the consumers have to pay monthly for the insurance company to be able to cover costs. And what this does is with higher premiums, it's going to drive away people who don't necessarily need as much coverage. So for example, an insurance company's premium is $400 a month. Well, for a healthy 25-year-old female, let's say, they're going to be thinking that in one entire year, I probably will not be need $400 worth of coverage for health services. So I'm not going to be wanting to be interested in getting that health insurance. However, if you have a 62-year-old obese diabetic woman with hypertension, they're going to be thinking with $500 a month, I can have a lot of my services covered. So adverse selection is when that 62-year-old obese diabetic woman with hypertension enrolls in that insurance. So you have in that health plan a lot of people who are paying high premiums because they have a lot more need of the different services, so it increases the cost for the insurance. Another risk is moral hazard. Moral hazard means that when they know that they have coverage, they are less likely to avoid risky behaviors because the cost is not entirely on them because they know that they are covered, so they don't have the responsibility of cost on them. For example, I can eat fast food as I want because I have health insurance to cover medical costs that my diet may cause. So the different adverse effects that an unhealthy diet might cause, they're not going to care as much because they know that they have health insurance, which means that it increases the insurance's cost for having to provide different services for that patient's care. Now, so with these different risks, insurance plans have a way to manage them, and I'm going to go over the different ways. So to manage adverse selection, so trying to avoid so many consumers who have a high need for care with high costs, so you could have a single risk pools, which means that the insurer, it combines all of its different plans into one risk pool so that it calculates, and then the higher costs of the less healthy are covered by the lower costs of the healthy. Risk adjustments was it was with the Affordable Care Act, and then the funds from plans that have lower risk enrollees, those funds are transferred to plans with higher risk enrollees. So basically, when the insurance company, when it determines like a price for the certain for its consumers, if one plan ends up with higher costs than the others, and the one with lower costs, the funds will transfer to the one with lower risk. Managing moral hazards. So you're putting more responsibility on the patient, so they're more careful with their decisions. So high deductibles and copays. So with this, the consumer has more stakes in their spending, so they are less likely to be wasteful, because if something does happen, they will have to be paying a share of the cost. And incentives. So insurance companies, for example, they offer discounts on gym memberships, so you're improving good habits to decrease the cost later on. So how are health plans financed? So how do they get the money to provide the different services? One is underwriting income, and that is whenever the premiums that they collect minus expense for claim costs. So the money that's left that goes to them, that's one source of income. Also, if the expenses exceed the amount of money that they're getting in, so the amount that people are paying in, there's other types of income, for example, investment income and investors. So for example, stocks and real estate. So this is how they could be funded. Now, the future of health plans. Where do we see healthcare going? Where do we see what lies in store for insurance plans? Well, population health, we have a healthcare system that's moving more towards analyzing population data to predict different diseases and how to manage them, and having constant intervention to be able to prevent. Retailability, so for example, walk-in medical facilities, you could have it in pharmacies where the patient can go in and receive healthcare from there, see a doctor, or healthcare professionals at a pharmacy, for example. Mobility, so mobile health apps, having patients having access to their phones and large amounts of information through a very easy way. Genetic testing, so this is how we get very personalized care, because analyzing, understanding the human genome and seeing what risk the patient has and what certain medications would be more beneficial for the patient. And then prevention, especially like electronic records, they inform treatment, and they could tell what certain patterns there are to be able to predict and prevent certain stuff. So with these different, for example, genetic testing, it can mean for insurance plans, they could have higher costs. And with different services, it would insurance plans would have to find ways to be able to manage the different costs. So in summary, a health plan, it helps consumers pay for their different medical services, whether mental and physical. There are different quality measures that can be used for health plans to not only have internal control, but also help them compare to other health plans. Health plans are under a risk for different risks. They have different risk factors, but there are ways to manage them, so it's important to be aware of how they can. And some ways to prevent these risks, that they include risk spreading and cost sharing, for example, copays. And it's important because there's a lot of stuff changing in the future that we can expect from now, and it's important for health plans. It's going to raise challenges for health plans to be able to see how to manage the costs that would come with new interventions. This concludes the end of my presentation. I hope the information I provided was useful. Thank you.